Hello, good afternoon. My name is Dr. Mary Sommerlad. I have the pleasure of working here at 108 Harley Street. I also work in the NHS. I'm a consultant dermatologist, and today for our CPD Snippets, I'd like to discuss sunscreen with you. So the aims of today's webinar will be to discuss the different types of sunscreen and what makes them up, when and how to use sunscreen, and some common sunscreen myths. So sunscreen is actually just one part of photoprotection. So this is protecting ourselves from damage to our skin triggered by sun exposure. It's really important to use physical protection in the forms of hats, sunglasses, seeking shade, long light clothing, and the avoidance of sunbathing. And that's including if you're able to develop a sun tan and never burn. We still don't want the skin to tan. So sunscreen is just one part of that. And this is just a little recap of the sunlight spectrum. So when we're talking about protection from sun damage, what do we want to protect? In particular, it's our UVB, which is typically associated with sunburns. It's easy to remember. UVB, B for burning. Then there's the UVA, which is associated with aging in particular, but can also cause significant damage to the skin and is also linked to skin cancers. And then visible light, which is very much involved with hyperpigmentation and particular skin conditions such as melasma. Why do we need sunscreen? Well, there's evidence that you can reduce melanoma by about 50% if you incorporate sunscreen into your sun protection routine. It lowers squamous cell carcinomas. It reduces premature aging. Aging is a very natural process. But what we don't want to happen is for that process to be unnecessarily accelerated. It reduces the risk of sunburn. Sunburn is very uncomfortable and tender, and every summer A&Es are full of people who have had severe sunburns leading to dehydration and very tender skin. Also improves melasma if you wear sunscreen throughout the year. Melasma is a condition that causes blotchy brown marks to appear, usually on the cheeks, forehead, chin. It can also appear on the upper chest of women. It can affect women of any skin colour, but it's most notable in women with olive and light brown skin tones. Sunscreen can also help improve post-inflammatory hyperpigmentation. So these are the dark marks left behind after, for instance, acne or eczema. Illustration to show you, this is the mole that nobody wants to see in a dermatology clinic. These are actinic keratoses and heavy freckling in someone who's had a lot of sun exposure. In dermatology, we call this field change. Some of these lesions can end up becoming skin cancers. This is a very famous photograph now of a gentleman in America who was a truck driver. In America, you drive on the left-hand side. He was not a sunbather, but he did drive trucks, and you can see on the left-hand side where the sunlight hit his face, there is an increase in fine lines and wrinkles compared to on the right side, which is relatively shielded from the sun. So this is what we're trying to prevent, premature aging. And finally, this is an image of melasma, so these brown patches, which often can be dismissed as a cosmetic concern, but actually it can be very debilitating and distressing for people affected by this condition. So what are our sunscreen constituents? We know we want to block out UVB, which can burn the skin, UVA, which can prematurely age the skin, and the combination of both can lead to skin cancers. And we also want to block out visible light for people who have issues with hyperpigmentation or the skin condition melasma. With UVB, what you'll see on your sunscreen bottle is SPF, and I think most people by now are familiar with SPF. It stands for sun protection factor, and it's a universal scale found throughout the world. And usually you'll see ranges from SPF 2 to SPF 50 plus. And increasingly I'm seeing SPFs that are even marketed as SPF 70 or 80. What the SPF actually means is it indicates how much longer in minutes it takes for your skin to burn with sunscreen on compared to if it wasn't protected. So for instance, if your skin on a very sunny day at midday, uncreamed up with sunscreen, burns within 10 minutes, applying an SPF of 30 increases the amount of time that you don't burn by so it takes you up to 300 minutes. So it's a really useful indicator of how to prevent your skin burning. But what it doesn't tell you is whether it gives you protection from UVA. Now, UVA is unfortunately doesn't have a universal rating scale. So you'll see lots of different words on the bottle, and this is what can cause some confusion amongst your patients and clients. So what we commonly understand is broad spectrum, and broad spectrum, the spectrum they're referring to is the sunlight spectrum from UVB to UVA, and sometimes a little bit of the visible light spectrum. So 90% of UVA is absorbed at 370 nanometers if a sunscreen has the name broad spectrum. What we know is UVA goes up to 400 nanometers, so broad spectrum alone doesn't give you full UVA protection. The next rating scale you might see on a bottle is the Boots star rating, and this is out of 5. And it basically gives you a ratio of how much UVB to UVA is being protected by your sunscreen. The closer you get to 5 means the closer you are to the ratio of you're blocking all your UVB and all your UVA. Increasingly, you might find patients who are buying sunscreens online, and they will have different grading scales, such as the persistent pigment darkening scale, or PPD. This goes up to 16, and it's very similar to SPF. So it will tell you whether your sun tanning that's being induced by the UVA, how much longer your skin can tolerate with PPD compared to without PPD. So a PPD of 10 means that it blocks out about 90% of your UVA, a little bit similar to your broad spectrum. And the scale goes up to 16. And then finally, there's the protection of UVA grade, or PA. And again, you'll see this more in sunscreens purchased abroad. It's very commonly used in the Far East, so Korea and Japan. And these are countries that make a lot of sunscreens that are cosmetically elegant and popular. And with your PA, what you'll find is the more pluses, the higher your UVA protection, and the scale goes up to 4 pluses. So 4 plus PA is equivalent to PPD 16, which is the equivalent to beyond a broad spectrum. And finally, visible light. This is important in melasma, and it's iron oxide, and there isn't a grading scale for that. What we just know is you're looking for a percentage of iron oxide that is above 3.2% in order for it to be effective. This is just a quick illustration to show you the difference between different SPFs. So the higher your SPF, the more protection you get from your sunscreen. So there are, broadly speaking, 2 types of sunscreen. One is chemical sunscreen, the other is physical sunscreen. Chemical sunscreens, if you consider them to be a bit like a sponge, what they do is they soak up your ultraviolet. So they absorb the ultraviolet in your skin, they convert the ultraviolet energy into heat, which dissipates. You don't physically feel this heat leaving your skin because it ends up being a very tiny amount of heat. There are many different types of chemical sunscreens. Newer agents are less sensitizing, they feel less irritating to people. The big pros of a chemical sunscreen is they don't leave white marks on the skin, they glide on very easily, and it's very easy to cover the whole body. The cons are they can be quite irritating, especially to those with sensitive skin, and there have been issues around the coral reefs, so marine life, in some of the particularly older chemical sunscreens. They're also known as organic because, for those of you remembering your chemistry A-levels, they have a carbon atom in their structure, so they're not actually organic in the sense of organic farming, it's just to do with the chemical structure. Then we have physical sunscreens. Again, these can also be referred to as inorganic because they don't have that carbon structure. Funnily enough, they also predominantly absorb sunscreen, but about 5%, they predominantly absorb UV rays, but they also scatter about 5% of the light. And the main ones are either titanium dioxide or zinc oxide. The big pros of physical sunscreens is you get immediate protection. They have a longer shelf life and they're less likely to irritate sensitive skin types. The cons are they can often leave quite a white mark on the skin. They can feel very heavy and uncomfortable, and they're harder to rub in, so they might paradoxically irritate sensitive skin by the amount of rubbing you need to put on. And finally, your iron oxide. This absorbs visible light and UVA, and it can improve the appearance of the white cast in your physical sunscreens because it has this kind of reddy brown colour. The pros are it's great for melasma and it's great for post-inflammatory hyperpigmentation. It also synergizes really well with zinc oxide, so you can get an improvement in the quality of your sunscreen if iron oxide is added. The downside is the product will have to be a tinted product, and for that reason it's probably only really suitable for the face, and there may be issues with finding the right tint to suit a skin type. When do you wear sunscreen? As a dermatologist, we recommend sunscreen year round because we know that UVA rays remain pretty stable. It's useful knowing about the UV rating, which these days you can get the answer on your mobile phone, and it will tell you how high your UV rating is. As you can see from this diagram, we always would recommend wearing a sunscreen and protection. Don't forget to wear sunscreen even if it's not hot, so cold temperatures like skiing, the UV is reflected from the bright snow and you can get a burn, even quite serious burns skiing, so don't forget sunscreen there. Don't forget your sunscreen if you're doing lots of water sports, because again the UV can travel through there. Very bright white sandy beaches are notorious for causing sunburns, so really important not just your sunscreen but to remain in the shade here, and your sunglasses. And just a reminder that for especially people who have hyperpigmentation issues, even on a cloudy day in the middle of December in the UK, they should be encouraged to wear sunscreen because as long as there is visible light, that will be triggering their melanocytes and they will be hyperpigmenting in their areas of melasma. So how to apply sunscreen? Most people probably don't put enough sunscreen on. We ask for at least half a teaspoon to cover the face, ears, neck and each arm. And then it's probably at least a teaspoon for the back, a teaspoon for the chest and abdomen, and a teaspoon for each leg as a minimum. We always remind you to reapply your sunscreen at least every 2 hours, or if you've been in and out of the water, because even if sunscreen is marketed as being 12 hours or water resistant for 80 minutes, if you're rubbing your skin, you're rubbing off the sunscreen. Don't forget to discard sunscreens when they're out of date, and this sign's really important. So remind your patients if they're using a sunscreen from last summer or 2 summers ago even, it won't be giving them protection. So it's incredibly important that you're using your sunscreen and that it's effective. And it's a common reason for people to burn is that actually their sunscreen is out of date. So now I'll just go over a few myths about sunscreen. As dermatologists, we come across myths every day in our practice around risks with sunscreen. So the first myth is sunscreen stops vitamin D production. And you can understand the logic behind this. We need UVB to make our vitamin D, and if we're using sunscreen, we're blocking out vitamin D. However, there's actually been very good studies in the literature that show that there's little evidence that sunscreen decreases the concentration of vitamin D when used in real life. So if you have a patient who has a low vitamin D, they're worried, please reassure them that they get enough UVB. And many people are vitamin D deficient, even if they don't use sunscreen and sunbathe. And the government actually does recommend some vitamin D supplementation. Second myth, I have SPF in my skincare, so my moisturizers and my makeup, so I don't need a specific separate sunscreen. And actually, you need to use quite a lot of your product to get the right amount of sunscreen protection. And most people are unlikely to tolerate such a high volume of that moisturizer being applied. So we recommend, even if your moisturizer or foundation says it has SPF in it, please reapply a broad spectrum sunscreen. And there are many cosmetically elegant options these days. Third myth, sunscreen makes acne worse. This was true in the past, but now there are many excellent sunscreens that not only are developed to complement people on acne treatments which can dry the skin, but that can also reduce blemishes. So look for things that say oil-free or anti-blemish or mattifying. The fourth myth is that sunscreen irritates sensitive skin. This could be again true for older sunscreens, but now even chemical sunscreens can be very suitable for sensitive skin. So just look for fragrance-free products, look for ones marketed for sensitive skin, and you can try 100% mineral sunscreens. And finally, people with brown or black skin don't need sunscreen. And although there isn't enough research that says sunscreen prevents acromelanomas, which are associated with darker skin types, sunscreen will help peri and post-inflammatory hyperpigmentation, which can really be very bothersome in darker skin tones, especially after acne or eczemas. It will help melasma, very useful for preventing premature aging. So for this group of patients, I would recommend if there's any kind of family history of skin cancer, or if there's a history of sunburns and freckling, or if your patient works predominantly outside or has a lot of outdoor hobbies and activities, if they have melasma, if they have hyperpigmentation, if they are sensitive to sunlight, you can see the list is huge. Recommend sunscreen. So sometimes it's easier just to recommend using a sunscreen that they find cosmetically suitable to prevent the complications of unnecessary sun exposure. So in summary, finally, there are lots of questions about sunscreen and marine life. And the last point I just want to make is check your sunscreen, check to make sure that if you're going to a resort, some of the products in your sunscreen haven't been banned by that resort, because there's increasing concern about the coral reefs in sunscreens. And these days, most resorts will let you know if there are any banned products. So in summary, sunscreen is one part of photoprotection. Everyone from the age of 6 months onwards can benefit from using sunscreen. Most sunscreens block UVB and UVA, and some will block visible light. There are many different formulations that suit all skin types, and vitamin D is still made even when sunscreen has been applied. Thank you very much for listening.